In both New York and London, what we're seeing is that obesity within the cities, in those two cities, is worse. The rates are worse than they are in the countries as a whole. 1 in 5 of our children are obese by the end of primary school. So again, it sets in early, and these are large numbers. And the rates are higher amongst boys and girls until they hit puberty, then it changes. And from our point of view, and one of the reasons that we're here today, is because it is inequalities in health that are implicated in this. This is not something that is just happening across the board in populations. It is hitting populations differentially. And that is a serious issue. I'm not going to dwell on the statistics on this because we don't have enough time and it's all in the document. But what we did want you to be able to see is just that if you look at overweight and obesity in New York, it sets in young. It sets in young. And that's a serious problem that it does set in so young. Again, while there's one of our key issues is that it is about inequality. So it is hitting communities differentially, and it's hitting communities differentially in respect of ethnicity. And I think you'll see, if you get a chance to actually read that document, that in some cases you get healthy populations who migrate into New York from abroad, and then their children become obese. So, that phenomenon, is it the case that if you leave another country and you come to New York or London, you've got a health threat facing you? That seems pretty dreadful. Again, this is not a particularly good slide, but what it shows you in London, again, is that obesity is differentially distributed throughout the population, and you can see that the highest rates are in the areas that we know have the greatest deprivation and inequality. Again, lots of work has been done in London Metropolitan on this. The whole question of, again, ethnicity, the impact, the distribution of obesity and overweight by ethnicity. And as you can see, some groups are more affected than others, and particularly Black groups in London. Now, very quickly, something about our approach. We are looking at the urban level. Now, the urban level does not exist in a vacuum, and we are incredibly fortunate in this country that, in fact, there has been a lot of really good policy formation that has been done at the national level. We've had the Foresight report in 2007, which really systematically looked at obesity and said, you know what? We live in an obesogenic environment, that ugly word, obesogenic environment. But it said it's not just about what in her bending and stretching. It's also the environment she lives in, she moves in, and so on, and that all of us do as populations. And that what we have to do, therefore, is to look at those big issues, those big institutional issues. And the Foresight report said we have to look at children, we have to prioritize children, we have to look at food policy, we have to look at physical activity. And so, we come back behind us to look at the urban health issue. Both of the collaborations are really committed to issues about inequalities in health. That's what our two universities focus on. And so we have taken that as really the center for our collaborative work. What are the inequalities that exist in the two rural cities? How are they, why do they exist? How are they shaped? And we use very much a social determinants approach. Again, UK is very lucky, the home of the major work that was carried out by Michael Marmot, the WHO, World Health Organization Commission on Social Determinants of Health. And what he said, looking all over the world, was it is the conditions in which we live and work which account more than anything else for the And we're using that approach. So we're using a social determinants approach. We're interested in transport, we're interested in housing and the impact. Our focus is not on treatment, on NHS treatment, for instance. We're also taking a human rights approach. And it's very interesting that over the 4 times that the United Kingdom has been assessed by the UN for its compliance under the UN rights of the child, we've been told every time that the big concern in the United Kingdom is poverty and inequality. And it is also the case that the President of the United States has said that he's very embarrassed that the US is one of 2 countries that hasn't signed up to the UN Convention on the Rights of the Child, and he hopes to put that right. And we were told by one contributor who works with the, not 2 who's there, but another one, from the International Obesity Task Force, that if the US took one step to meet the needs to deal with obesity, what it ought to do is sign up to the Convention on the Rights of the Child. We've been thinking sustainability in the financial crisis all the way through this. We know that, and the chief scientific officer in this country has said that we're facing a perfect storm in terms of food security, that's connected to the climate change agenda. We have very serious issues that we have to face. We also have a massive financial crisis. We've been told for a very long time, again, in this country, we've been told that unless we get the whole of the community engaged and the whole community, the institutional structures, all those social determinants, and the business community, if we don't get them engaged in addressing the major threats to our health, which are leading us toward these big epidemics in non-communicable diseases, the diabetes and so on, then forget about public services. We're not going to be able to deliver. We're going to go bust on that. So we've been thinking about that significantly. So what we've done then is to come up with an approach where we say, let's look at the environmental issues and let's try to set things up in such a way that the healthy choice really is made more feasible by the living and working conditions that people experience. Let's make sure that we think about access every step of the way so that it's really inclusive, and then only do we talk about the programs and projects that we need. Kim.